Hello everyone, and welcome to today's Smart Talk. So let me introduce first our today's speaker, Mr. Anush Parekh over here. So he's the co-founder and CEO of HealthySure, one of India's fastest growing platforms for corporate insurance and employee benefits. So Anush works with HR teams from startups to big companies and helps them choose smart health insurance plans that saves money and take good care of employees. Lot of real experience with insurance policies and claims and renewals, and he explains everything in a very simple and practical way. So in today's session, Anush will talk about common mistakes HR teams unknowingly make while buying group health insurance and how to avoid those mistakes without increasing any cost. So sit back, get your questions ready, and let's warmly welcome our speaker, Mr. Anush Parekh.
Thank you, Gaurav. It is wonderful to be at this forum and educating, you could say, the custodians of the employee welfare and employee health with a topic that is very sensitive, which can make or break a person's healthcare finances. So, would be happy to walk the forum through how we can effectively curate the right insurance programs and what could be the common mistakes that HR heads, CHROs could avoid. So, for me to have a quick understanding of the audience, can anyone, can we have by show of the hand emoji, know that how many of the HRs here are working in setups with more than 200 employees? And then I'll ask the latter question. So, by just show off the emoji on the react button, if anyone can just, or rather by raising the hand on this, can we know how many of the HRs here are above 200, managing organizations above 200 staff strength? Okay, and how many are between 50 to 200 employees? Like the organization team strength being between 50 to 200 employees? Understood. So I will then now proceed to start the conversation. If anyone has any questions, please feel free to mention in the chat box. So chat box. I'm just going ahead and presenting my screen, and I have Harshil in my team who's also there on this call. He can also in parallel answer any questions that you have by feeding into the chat box. Okay, so let's begin. So, as introduced by Gaurav, we are here today to learn five very costly mistakes that HRs could potentially make while buying uh, corporate health insurance or group health insurance, as we say, and how do you effectively avoid them. I'm the co-founder and CEO of HealthySure. We are an insurtech powering group insurance for more than 1,000 plus organizations and covering more than 300,000 lives in the country, and we have experience of running the operations for more than 5 years, so we are quite aware of how where do things typically break. But we'll now speak from the HR lens for the first time, and let's begin. So there's a crisis call that comes to you as an HR at 3 a.m. Every HR leader may know this moment. It could be none other than an employee seeking an insurance clarification. Somebody's parent, somebody's dependent is hospitalized, and they just don't know how to go about the process. And this is that make or break moment between panic and peace of mind. So, where do HRs typically fall short? These problems don't start as HR problems. They begin with a promise, a policy, a clause that no one has read carefully enough, and nobody knows how to go about it. So, as an HR, do you think that this is something that you would want to be the first point of contact for? Or do you not believe that your team members should be aware of what the right process or right, what are the terms of the program are. And yes, naturally, at a time of an emergency, reach out to the concerned person who can help them the best. Only in the scenario where they are not able to get through, should they come to the HR for resolution. But typically, we've seen most HRs acting as the first point of contact, and their insurance partner or broker is the second point of contact for the end user. So, one thing is that not having the right set of access for making an insurance claim. But second is also what are those, you could say, gaps in the policy that make things escalate so quickly. So today we are there to learn these common mistakes that HRs could potentially make while buying group insurance for their employees. The first mistake here that we can talk about is room rent cappings. Can we know how many of you are aware of what room rent cappings mean? By show of hands, anyone? I'm sure most of you are aware. Okay, I'll proceed. So, generally, an employee does come back to you with the query that why has my claim not been fully settled? I was always admitted to a network hospital or even see even non-network hospital. I have submitted all my documents accurately. So, the common answer here is that either the policy has room rent capping, it has co-payment, or it has disease-specific caps, or there is some waiting period, or there is some pre-post hospitalization cap. So, these are five reasons why potentially the claim is not fully settled. So, what does room rent capping mean? Example, if say the policy covers room rent up to 5,000 per day, say you have a 5 lakh policy and the room rent capping is 1%, which is 5,000 per day. And say the employee ends up getting admitted to a room which is 10,000 per day and he's hospitalized for 2 days. The general, you could say, perception would be that if the claim value is 2 lakhs, the employee should potentially get 1 lakh 90,000 back. 10,000 is something, 5,000 per day excess into 2 days that can be deducted. But answer is, hey, no. You have chosen a room which was much higher than the allowable eligible category, which was 5,000. So what otherwise would have costed 1 lakh rupee for the treatment, say a cataract surgery, is now costing 2 lakh rupees. So suddenly the entire bill gets inflated because you've chosen a higher room category and the insurer put a room rent cap to make sure that you use a room category where the overall cost also gets balanced out. So because you've taken a higher room category, you will be settled only 5,000 upon 10,000, which is the eligible upon the actual room rent. And eventually you will be settled only 50% of the overall hospital bill, which is 1 lakh rupee. That one single room rent capping definition ended up only settling 50% of the total hospital bill for the employee. We typically recommend that you should have 2 to 4% of the sum insured as your room capping. Even better could be no room capping. But when you go for no room capping, your costs may remain unchecked. People may end up accessing suite rooms, which is not the purpose of insurance. Had that been, they should have bought a personal health insurance. So the idea is to keep the room rent caps healthy at 2 and 4% so that there's a 5 lakh cover, you can access room rent of 10,000 per day and the claims can eventually get fully settled. But the idea is that the person should know what the implication of this room capping is by having the right insurance partner to help them resolve or clarify these concerns at time of admission or before admission. Second is the co-payment clause. So under co-payment, we see that typically good policies have 0% co-pay and say policies which have bled in the past and the employer wants to control the costs, they typically do insert a co-payment clause of 10 or 20%. But what does that mean? To the extent of co-pay, the employee will have to pay out of pocket. So say, for example, the sum insured is 5 lakhs and it is 20% co-pay. Even if somebody is admitted for a 3 lakh hospitalization, while the treatment is under 5 lakhs, you will be settled 80% of 3 lakhs, only 240, and 60 will have to be borne out of pocket. So this is where HRs get the criticism. Why did you give us an insurance in the first place where it was not going to fully cover ourselves? So we recommend strongly that if in case you want to control your costs, you may at best uh, reduce the sum insured from say 5 lakhs to 3 lakhs, but don't give a co-payment option or don't put a co-payment clause in your policy, because that creates a very betrayal kind of an experience for the employee during a medical emergency. Let them top it up their policy by additional 20 lakhs, 30 lakhs if they feel that this is inadequate. But our recommendation is never have a co-payment clause in a policy. If at all, it could be for parents, but not for employees, spouse, children. I hope you are clear with what co-payment means. Okay, I will proceed. So the third mistake possibly could be disease-specific cappings. So generally, policies again should not have any disease-specific caps. But we've seen in very large setups with where the employee strength is above 5,000, where every penny starts mattering. They introduce disease specific caps that while there's no room rent cap, no copay, but there's a disease specific cap. So, say for diseases commonly occurring like appendix, gallbladder, hernia, hysterectomy, piles, there are specific cappings in the diseases. So, even if the claim is worth 50,000 for hernia, the employee, even if there is no room capping, there is no copay, will be only settled the disease specific limit, which is 20,000. So again, not the best experience for your employees. So read the fine print clearly. Next is waiting periods. What is the primary reason why anyone buys insurance on group side? The reason is that the waiting period should be nil, which is no waiting period. Everyone should be covered from day one. Even a newborn should be covered from day one. But what do retail policies have? They have a 30-day waiting period and 2 to 4 year waiting period. We've seen so many agents in the market who end up recommending you could say an improper insurance construct on group insurance to their clients, where they end up having waiting periods of what retail policies are. That is up to 2 to 4 years for pre-existing conditions. So if you're suffering from, say, blood pressure, and if somebody gets admitted for heart surgery, then that treatment is not covered for 2 to 4 years, and that too with the same insurer for which you have continued to renew. And in group insurance, you typically don't have the same insurer year on year. You may want to switch to another partner. So a very broken policy term to have in a group insurance, where it could lead to a very poor experience for an employee, where the sole purpose of group insurance gets defeated by having a waiting period in the policy. Any doubts in understanding what waiting periods are? I must comment that the audience is super smart and we don't have any query on the waiting period. But yes, feel free to reach out to us if in case there are any questions around what waiting periods are and how do you best design your policy. Uh, don't settle for a premium or don't settle for a policy just in the bid to control the cost. Waiting period is something which is non-negotiable. Ignoring the pre and post hospitalization costs. So typically all policies have 30 days limit for pre-hospitalization and 60 days limit for post-hospitalization. Now, if you want to have the best policy for your team, you may want to keep 60 days pre and a 180 or 90 days post-hospitalization, which means that while you are admitted for hernia operation, but before that you would have consulted your doctor, you would have undergone some scanning, you would have taken some medicines, and likewise after discharge, you would undertake certain medications. Say a doctor may ask you to do follow-up consultations, or in certain injuries, you also need to do physiotherapy. So if you have handsome limits here, this will help your employees even get those smaller 10-20% odd spends on that treatment covered by way of pre and post hospitalization. So even if say the total treatment cost is 50,000, but say that miscellaneous 10, 15,000 worth of spend before and after hospitalization, that can also get covered under this clause. So having a good pre and post hospitalization period is super essential to design the best coverage. So we discussed five mistakes: room rent caps, co-payment clause, disease-specific caps, waiting period, and pre and post hospitalization limits. Next is on like why do we feel that HR is a silent problem solver? So imagine if you design the best policy for your organization. These are some public stats from a verifiable source that 73% of the employees say that their perception of HR depends on what benefits they get, because salaries and compensation structure is something that is already preset. It is decided by the management. But when it comes to choosing the right insurance partner, right provider, everything boils down to the impression of the HR getting impacted if the experience goes for a loss. 4.2 times higher trust in organizations where HRs proactively resolve or solve for health and wellness challenges, and 68% reduction in HR escalations. Of all the escalations, 68% escalations come due to insurance queries. And there's clear reduction in these escalations when you have integrated care systems with having both insurance and primary healthcare in place. So if all of this is done properly, doesn't mean that HR is applauded, but the problems are silently solved. And hence we've said that HR is a silent problem solver here. And your impact may be invisible, but it will always be felt if it is missing. So this is super, super essential for HRs to be mindful of, that if you want your organization to value your set of contribution, having the right insurance program in place, even if it means fighting it out with the management, our HR also keeps challenging us on what benefits we should offer to our team. So even at the cost of having you could say, a constructive discussion with your management, it is essential that you design the right programs for your team with the right benchmarking. So we'll come later. We've also created one inquiry form for anyone who wants to have a complimentary audit of their policies to know how does it fare in comparison to market benchmarks. So we can help you with that study so that you can convince your management. So, what changes to HRs uh, see when they are properly advised? So, you'll see fewer escalations, fewer surprises, and clearer decisions, simple trade offs. And how is the new age approach on choosing the insurance program or other employee security? Earlier, everyone traditionally has just compared quotes and chosen the insurer based on price. They will only discover gaps when claims happen. Versus the new approach is all the leading HR, CHROs, they map the claims analysis of their team as to how many claims are being made by what set of employees, whether they're dependents, employees solely, their spouse, children, or parents, to discover health patterns and design the right program for their teams so that any frictions that could arise on at the time of claim are resolved proactively. And by having the best partner in place would make sure that the entire experience runs smooth. Your time is very critical and it should not be spent towards resolving or firefighting for insurance. And what happens when the support is proactive? Or rather, uh, I would want to show you the experience of what happens when the support is proactive and not reactive. So, before enrollment, we already discussed having the right design tools for choosing the best plan for your organization based on your budget can always be custom designed in group insurance, and that is the best part of group insurance. What happens during enrollment? We can have like a partner who can help your team with clear communication, answering questions before they become doubts. So, having a proper policy briefing session at the start of the policy and doing it as a quarterly practice is advisable. And throughout the year, having a partner, I'm not going to comment just Healthy Shore, anybody for that matter, having that right partner who is available 24/7 for your insurance claim support with the right set of guidance on how to make the claims is super essential. So, this is what a proactive support is. And at renewal, having data-driven recommendations on how should you best structure the policy with those benchmarking tools. How many of you would want to have a partner who can solve for all of this? Please, would love to have it by show of hands. Okay,
Guys,
so
I
I can
have changed the
see.
setting. You can unmute yourself, yes, even if you can talk. If my Anush permits, you can even raise your hand. You can unmute yourself.
Yes, was there anyone who had a doubt here? No. Okay, so I'll proceed. So, we can also help you solve more than just for insurance. Problems that are typically not covered under your traditional group insurance. So, for example, OPD cover. How many of the you would, or rather, how many of your employees today would have, say, OPD spends towards medicines, doctor consultations, diagnostics, vision dental spends? I would believe almost everyone, right? Versus how many would actually make a hospitalization? Maybe 5%, 10%. So OPD coverage is more universal in nature to offer your employees. And we have seen all the best HRs offer an OPD program over and above a traditional health insurance. Doctor access, having a doctor in place for first opinion, second opinion, guidance on the treatment options helps very well to even bring down the incidences of claims. Mental wellness counseling, all of us in the fast moving world see a lot of stress and burnout, typically with so many expectations being set, teams becoming leaner, personal challenges. So, mental health is equally critical to help your employees stay at peace and productive at work. So, players like us, which is Healthy Short, helps you have all of these benefits under one place, whether it's your OPD programs, doctor access, or health and wellness support. We also offer solutions for health tracking, lifestyle guidance, diet and nutrition planning. And also, we provide 24/7 emergency support whenever it is about getting an ambulance to transport the patient or move the patient from home to a hospital or hospital to another hospital. We guarantee you a ambulance in 500 plus cities under 20 minutes. Now tell me, is it something that you should not expect from your insurance partner or broker? Yes, right. But all these brokers today fall short because they don't have a tech platform in place to integrate all of these offerings. And this is what an integrated solution can solve for. So I would always recommend HRs that if you want to create better benefits for your team, ask beyond insurance, what am I getting? Can I add some more benefits to the program? So this is the question that the HRs of, say, the post 2020 era are increasingly asking, and so should you, if you're not asking right now. And with this, employees feel safe, they trust the organization more, and more importantly, they feel gratitude towards the organization. And how does the HR benefit? 70% of your time is saved, 85% lower stress for you also as an HR. That is equally critical, right? And 90% of your employees feel confident. So these are not efficiency gains. These are differences between constant anxiety and quiet confidence. So we want to have all of your team members get into this state of mind, which is quiet confidence. And what is the right ecosystem to enable this quietly? Uh, it starts with reviewing your pain points first. So if anyone comes to us, the first question we ask, what was your experience last year? How do you rate it on a scale of 1 to 10? that is the starting point for us to know that where does the experience fall short and areas where we can help you plug those gaps. We help you study your demographics, the family structure, and also help you with benchmarking statistics. That how can you design the best coverage? And uh, this is our job as a broker that we proactively guide you and you should evaluate beyond premium. Everything should be supported by data. Without data, there is no evidence of how will a particular benefit help you solve this. So today we are happy to do a soft launch with Pocket HRMS team. We are going live with a group insurance program with employee benefits starting at just 199 rupees per month. This is an exclusive program for Pocket HRMS partners. All the clients that have benefited with Pocket HRMS services. Now you can also access group insurance for your teams at you could say maybe three clips to just register your interest and a 30-minute call to understand how these benefits will be structured. So it will be a breeze once the program is rolled out for you to manage and delete members. The exclusive program has benefits of three plans, where a plan of 2 lakh sum insured will cost 199 rupees per month. A gold plan of 5 lakh sum insured would cost 299 rupees per month. And a platinum plan of 5 lakhs with maternity benefits with 10 lakh accident cover will cost 399 rupees per month. And that is nothing like 399 into 12, 4,800 rupees plus GST might be about just 0.5 to 1% of the overall CTC of an employee. But imagine the peace of mind that we could create with this kind of a program, which is a platinum plan with 5 lakh sum insured, 10 lakh accident. So 5 lakh for health insurance, 10 lakh for accident cover, and the benefit of maternity further being covered. Why choose this plan? This is standardized, whether it's a 10 member organization or 500 member organization, the rates remain the same because we are aggregating the portfolio at a universal level. We are voted top ranked in terms of the claims experience. For a moment, I would want to show you our claims experience, that how people have rated us 5 star on almost every possible claim. It is also evident from our Google listing. As I've said, we are proud of data sets commenting what that experience is. So this is like proof for you that we will help your employees with hassle-free, cashless, and even reimbursement claims being paperless. And the policy is plug and play. Once you sign up, so for the while this is a soft launch, we'll go live on 1st of Feb. But once this is live, within 3 days, your policy is issued, and you just go to the portal to manage and add delete members. So we have a dedicated portal through which you can access what is the overall team strength and to add delete members. We can also help you with an integration to the Pocket HRMS so that all your addition deletions are auto fetched. So we have integrations with Pocket HRMS here. We can also help you resolve all your or track all your claims at one place and one window. And we have a 24/7 claim support from here for your employees to access. All of this is available as a web portal and an app with a personalized human-led support. So this policy will have 30-day waiting period, but it has no waiting period beyond 30 days for any of the other diseases, whether it's pre-existing, specific, or accidents. So we would encourage the HRs who join to potentially explore this solution. And if you need any custom solution, we can help you there as well. So this is a policy which covers just the employee. But if you need spouse, children, parents to be covered, the commercials will be different. We've mentioned per month, that is the price that is derived on a monthly basis, but it will be billed annually. So if anyone joins in the middle of the year, then you will be charged pro rata for the remainder period. So did anyone have any questions here? Okay, so we'll proceed. So what does Healthy Shore offer? We offer group health, group accident, group term life insurance, and we offer health and wellness solutions, whether it's doctor, health checkups, gym memberships. And we also have a retail and commercial stack to offer cyber, marine, fire, travel, asset, uh, and other embedded insurance programs as well. So if your company requires fire insurance, transit insurance, or say asset protection of laptops, furniture, all of that can be managed by us, including cyber insurance for any data breaches. Uh, so that brings me to the end of this session. We have kept a complimentary group insurance audit for all of you. So I would encourage that this is just an exercise for you to benchmark how does your policy stand in comparison to what the wider market is offering. You would always get comparisons from your employees saying that a company in this space is already offering me this, or my last employer was offering me this. You don't want to be in a spot, right? You should have the data at your disposal that where does your policy rank in comparison to the market benchmarks for the same size of organization, for the same sector of the organization. So we'll help you with those data points. So yes, we'll be happy to review your policy for any of those five mistakes if there are any, and we would help you with the right benchmarks. There's no obligation then to engage with us on this insurance program. The insurance program that we spoke for is independent. You can always access this, and if you want you can even if you want to access this part of the program, because it's a soft launch, you can still fill up the form. Our team will get in touch with you to keep the readiness, but this is more so for a complimentary group insurance audit for your organization. I'm guessing everyone here who has joined, uh, I would believe that 80% of you would potentially have an insurance, right? So we can help you guide here. And if those who don't have it, I would recommend you should have an insurance program for your employees right away. Take that important step before it is too late. I'll keep this on the screen for a couple of minutes in case anyone wants to scan it. Separately, Harshil, can you put the link on the chat box? Yes. So Harshil, given the link to the complimentary insurance audit in the chat box, so you can have a look. So yeah, that brings us to the end of this session. Gaurav, uh, any closing remarks or any questions from anyone?
Guys, you can unmute yourself. If you have any question, feel free to ask Anuj. We still got 10 to 10 minutes left for the webinar. You can ask question by unmuting yourself, raise your hand, or even if you're shy, you can even put your questions in the chat box as well. We'll keep forum open for next 5 minutes.
Good
Okay,
evening,
Anuj.
sir.
Yeah, yes, there is question.
Good evening, sir.
Yes. Good evening.
Myself Santosh Kumar Pal from Eklavya HSG DKY HR Manager. I need
Okay.
to review the group in GPA policy once again.
Okay. Okay. So, you want to reach out to us, what you can do is you can just fill up the link that has been shared on the group, and then we'll get in touch with you.
Okay. And GMC?
So, GMC is group health insurance. We can naturally support you both health and accident insurance all under one roof. So, imagine like having a dashboard through which you can centrally manage all your insurance programs at one place. So, whether it's group health insurance, it is group accident insurance, group term life, you will be able
Okay.
to manage all of this at one single platform. That is the beauty of it with your CD balances. So we can support you on both the requirements.
Okay, sir.
Harshil has also mentioned his number in case you want to directly just pick up the phone and call him. Thanks, Santosh.
Okay.
I hope that people found the session relevant. I hope you had something to gain from this. Uh, if not having to say consult us or otherwise, we are just here to support you in the journey. But I hope at least you had some takeaways from the session. Okay, then I guess Gaurav, we can close, right? Uh, Wishing everyone a very happy weekend and a great uh, Republic Day that we are going to celebrate on 26th.
Okay, thank you so much, Anuj, for joining in. Thank you, Arshil. Thank you all for joining in today's session. And we'll see you soon in the next edition of Smart Talk. Have a great weekend and a happy Republic Day in advance. Bye bye.
Thank you, everyone. Bye.